Do you eat? Well, that's a silly question. Of course you do. And unless you grow all your own food, you have a farm worker to thank. During the pandemic, farm workers were finally recognized as the essential and unsung heroes they are, the people that feed the world. But farm workers often live in a context of low wages, high density housing, poor living conditions, undocumented immigration status, language barriers, and limited access to preventive health care. My name is Joy Jacobs, and I'm one of the 6 founding members of our organization, RESpuesta para la Prevencion de Infecciones Respiratorias en Agricultura, which is the response to prevent respiratory infections in ag, or RES.P.I.R.A, which means breathe in Spanish. Our organization seeks to improve health outcomes related to respiratory infections such as tuberculosis through education and outreach to farm workers in the Immokalee, Florida region, which has the state's highest population of seasonal and year-round farm workers. My colleagues Elizabeth, Amari, Shubha, Micaela, and Jaslina will describe about why and how our organization is structured.
So why is the work of RESpuesta critically important? Giving our motivation and some context behind the organization. The CDC estimates that there are around 4.2 million farm workers in the U.S. The data on tuberculosis among farm workers is clear. Farm workers are 6 times more likely to contract tuberculosis when compared to their non-farm worker counterparts in their lifetime. Many barriers exist to farm workers accessing healthcare and having recourse and protection from communicable diseases like TB. The CDC has put out many recommendations, all of which are really required for concerted effort to curb the disproportionate impact of tuberculosis on migrant and seasonal farm workers living in Immokalee, Florida. Some of which include early and widespread screening, detection and diagnosis, including PPE for symptomatic patients, and education on how to prevent, diagnose, and treat. This is a problem that RESpuesta, in partnership and in conjunction with the community that we serve, seeks to solve.
We envision a world where farm worker families and communities lead healthy lives by empowering them to prevent tuberculosis from occurring in the first place and to seek care when it's needed. We improve the health of farm workers in Immokalee, Florida through education, advocacy, and training around the prevention and treatment of tuberculosis. We value respect, connection, and inclusivity. We implement programs that honor the essential workers of Immokalee and their contributions to the community, all while remaining adaptable to the ever-changing needs of the workforce. We promote connectivity across all members of the organization to instill a sense of commitment to the mission. And we strive to include members of our target audience, Immokalee farm workers, in decision-making and advisory to make sure that our organization advocates for the needs of the community that we serve. For example, we have worked hard to ensure that at least 50% of our employees come from migrant farm worker backgrounds, and we prioritize bilingual communication in the messaging that goes out to employees, partners, and advocates.
Hello, my name is Amari, and I will now talk about our strategic plan. We will talk about this in the terms of goals, our objectives, and our strategies. Our ultimate goal is to decrease the TB infections among farm workers. We want to do this by 1, reducing the new cases, which is incidents, as well as reducing the burden that TB has on farm workers. The way we're going to do this is by 1, education, 2, safety, and 3, support. Education in general, so that means including when you should get tested, things to look out for as far as symptoms, the importance of PPE, the importance of testing, and how to share this education genuinely with the entire community. I also want to talk about a lot of safety materials, which is PPE, and then talk about, when you are positive, what can we do to prevent from spreading? So that's surgical masks, washing our hands, being spaced out, and things like that. As far as support, we want to pair people up with case management, which means that they will also be paired up with local organizations in the community that can help with housing, food, and monetary benefits.
Hi, I'm Shubha, and I will be discussing our org chart. We started first by determining what our mission was, and then how we would accomplish that mission. And then we developed an organizational structure that would best support our mission, programming, and populations. We start with an executive director who will oversee all organizational activities, with 4 directors who report to her. Our director of operations will oversee 2 case managers that work directly with our farm workers. Our director of health promotion works closely with the cultural liaison to ensure that our program is relevant and appropriate culturally and folds in important health promotion principles. Our director of communication will work with our translator. These positions are important because they will handle external and internal communication and allow us to communicate bilingually. Lastly, our outreach coordinator will oversee 2 educators who will also work closely with the populations we serve. The structure of our organization allows us to work closely with each other and maintain a fluid, strong communication and reporting system with clearly defined roles. We hope this structure will allow us to effectively reach our mission.
Hi, I'm Micaela, and I'm here to go over our organizational budget. This page displays all of our employees, their job titles and descriptions, and their annual salaries. With the average household income being just under $31,000 a year in Immokalee, Florida, we felt it was important to compensate our employees' salaries indicative of their level of expertise, but also representative of the area they work. We found it to be unethical to pay our employees at exorbitant levels for the work they do with those living primarily in poverty. You'll also see that our educators and cultural liaison are unpaid. This is because those positions are filled by volunteers. The educator positions are held by graduate students participating in practicum experiences, while the cultural liaison is a community member with close ties to the farmworker community who volunteers as a go-between to ensure all of our initiatives take the needs of our target population fully into account. With included fringe benefits, our total employee salaries for the year comes to $498,906. If we take a look at the full budget for RES.P.I.R.A, we see that we allotted $75,000 for customer appreciation to purchase PPE, hygiene products, and other small goods for farm workers. We allotted $10,000 to the creation of a simple organizational website by an outside contractor. $5,000 was allotted for postage for the mailing of letters and informational pamphlets. $10,000 was given for training supplies and materials. $8,000 was set aside to rent covered outdoor parking in Immokalee for the organization's vehicles. $9,400 was set aside for meal allotments for educators and case managers on days where they're working out in the field. $25,000 was set aside for gas. $190,000 was set aside to purchase reliable trucks and transporter vans that could be used by field employees to conduct organizational needs. Additional expense categories and justifications for omitted expense categories can be found in our budget spreadsheet. Our total annual budget came to $900,802. We decided to hold the last $100,000, or 10% of our budget, in a discretionary fund to be used by our organization in completing our missions and accounting for possible budget overages.
For more information, visit us at www.immokalee-respira.org.